I'm Dr. Crispin Pierce. The course is ENPH 110, Introduction to Environmental Health. We satisfy several LE outcomes. I make sure to cover elements of independent learning, of cross-disciplinary learning, so it'll check off a lot of those important boxes. I think you'll get to know a lot of people around campus. I have many different kinds of majors who take the class, so you get to make friends that you'll see over the next 4 years. And of course, it's a great opportunity to find out if the ENPH, Environmental Public Health major, is a good fit for you. In ENPH 110, Introduction to Environmental Health, we look at all the ways in which we have interactions with our environment, whether that be the food that we eat, the water we drink, the air we breathe, the soil we use, our housing, disease transmission, and understanding those ways in which we can protect ourselves, live long and healthy lives, and also have a sustainable environment around us. Well, the course is pretty well structured. We have chapter reading out of the textbook. We also have personal assignments where students are asked to answer questions like, if a woman is pregnant, should she be given special consideration in a workplace so the fetus doesn't get exposed? We have group projects. The students put together little video projects. They work together to create an explanation of something they're really interested in, like Zika virus transmission or West Nile virus or a new meningitis outbreak in college-age students. So they put together projects. We have a stated textbook and regular personal assignments that are done. There are a number of videotapes, little video segments that illustrate the principles we learn about. So what about safe water? What about using some of the instruments? What about too much noise that a lot of college students might be exposed to? So those are the kinds of video clips that we have. The online class goes at a self-paced progress, so students can complete as much as they want when they want while staying in touch with their group members. The face-to-face, we get to do little in-class field trips, like we go inspect Sodexo food facility, make sure the food is being prepared safely. We go down and test water quality in Little Niagara Creek. So the face-to-face has a little more interactive activity, and in both classes we cover that same introduction to environmental health material. You get to work in groups and solve problems theoretically. You get to solve real problems. You get to go and take a look at the water quality in Little Niagara Creek. You get to see obesity on campus. You get to see what happens when we're doing construction on campus and maybe take some noise measurements. I like to think it's very fun and interactive, but also very, very meaningful, because we are protecting people's health. We're learning how to go into careers where we'll be working in health departments or in private industry to make sure workers are safe, or make sure if there's a romaine lettuce outbreak, we know how to control and contain that. So it's fun and at the same time making a difference.
Is there any